idea of turning generation rent into generation buy. The various ideas you heard from the Prime Minister and the reality of it. Scandal hits the Church of England. Terrible failures allowing child sexual abusers to hide away. We'll give you details on that. Hundreds of musicians came to protest outside Parliament. They hit the right note with their protest, but is anybody listening? And we'll talk about the London Holocaust Memorial, which is now possibly not going ahead because terrorists will see it as a trophy. So we're just going to back down, are we, in the face of criminal action? Seems a strange decision. It's later in the show.
Nick Ferrari at breakfast. Call 0345 6060 973. Text 84850. Nick Ferrari at breakfast on LBC.
Right, let's talk a little bit about how the numbers have increased. The United Kingdom recorded another 14,542 COVID cases yesterday. That's almost 2,000 more than the preceding day. And hospital admissions in England have hit a 4-month high. Now, it's important to say, despite this very, very gloomy news, it is nowhere near the Armageddon that was initially forecast by the medical and scientific advisors. So I'm not pretending it's not grim. It is dead grim, but it's not quite as bad as that. We'll talk in a moment about the regional breakdown, but the most important figure, and my sympathies and commiserations go to you, 76 deaths linked to the virus were reported on Tuesday. Now again, you need some context. What does that mean? Well, when I tell you the day prior to that it was 19, that is quite a spike. The total number of people who lost their lives is 42,445. And again, commiserations if you have been touched by this terrible, terrible virus. And hospital admissions in England, an extra 478 on Sunday, and that's the most recent day that we have figures for. Again, you need context on that. Well, it's about 25% lift on the preceding day, and it's the highest since the 3rd of June. Enough of the figures, the background to that, and more detail. LBC's political editor, Theo Thea.
The latest COVID-19 statistics are causing concern in government. Hospital admissions up 25% in a day. The number of recorded new infections now more than 14,000, triple the number of a fortnight ago. In Scotland, the figures showed that nearly 700 people tested positive for coronavirus in the last 24 hours. And amid fears that Scotland could be on the verge of a circuit breaker lockdown, First Minister Nicola Sturgeon announced further restrictions north of the border would be coming imminently.
This is probably the most difficult decision point that we have faced so far, and I want to try and explain why that is the case. Right now, as our figures demonstrate, and like many other countries, we face a sharply rising rate of infection again. Not as sharply rising as it was earlier in the year, but nevertheless it is rising quite markedly.
In his virtual conference speech, Boris Johnson looked to quell disquiet in his own party about the restrictions, such as the mandatory wearing of face masks and the rule of 6. He did that with a promise that social distancing will be over by the time of the next Tory party conference in the autumn of 2021.
We will succeed, just as this country has seen off every alien invader for the last 1,000 years. And we will succeed by collective effort, by following the guidance, and with the help of weekly and almost daily improvements in the medicine and the science, we will ensure the next time we meet, it will be face to face and cheek by jowl.
Labour leader Sir Keir Starmer criticised the government for not having a plan to bring to an end current restrictions.
Everybody can see that infection rates are rising. Lots of areas and restrictions don't seem to be coming out of it. And the testing regime just isn't working. We even lost tests in the last few days. So what people I think wanted was a frank acceptance that those problems are there and a roadmap to get out of where we are now, where we need to be, a roadmap, if you like, from here through to when we get a vaccination.
Sir Keir Starmer there. Right, let's turn to a couple of experts and then check your views. We'll talk about what it means for the NHS, the front line, in a moment. Let's first turn to Dr. Chris Smith, who's a broadcaster and consultant virologist at the University of Cambridge, and has helped us through, I was going to say the many weeks, sadly it's the many months of COVID. Okay, good to have you on again, Doctor. Break this down for me. How concerned are you? You are an absolute expert in the field. Is this to be expected when students go back to university, some people go back to their place of work, and children go back to school? Morning, Chris.
Morning. Yeah, lots has changed, hasn't it? We had a lockdown, everyone knows that, we're still feeling the acute effects of that. And that was very effective. It suppressed the level of transmission of the virus down to extremely low levels. And then, of course, we began to open things up again. And as we opened things up again, that meant people going back to work, it meant people going back to school, it's meant people going back to university. At the same time, there's been a bit of an attitude among people, and this is not condemnatory on my part, it's just an observation, and the World Health Organization dubbed it people letting down their guard. And it wasn't just us here in the UK, it was everyone everywhere. And people began to feel that collective sort of sense of relief. Thank goodness it seems to be over. And that then led to even more transmission. And these things take a little while for the snowball to gather momentum. It's gathered momentum over the tail part of the summer and into the early autumn, and that's why there was the decisive action announced from pretty much all the parliaments, because they spotted that the trend had drifted upwards, and was beginning to accelerate. And these things grow in an exponential way, which means that the more cases you get, the faster you get the next bunch of cases, so the curve spikes. And we predicted this was going to happen. It's obvious if you've got a transmissible disease, the more conduits there are for that to flow through, the more contacts between people, the more cases you're going to get.
Chris,
The question becomes what level we will tolerate and what amount of this we can control.
Sorry, Chris, why the regional breakdown? Because I looked at figures yesterday, 113 and 117 in the northwest and northeast are confirmed cases, 10 in London. Why this regional split, Chris?
I think there's a range of reasons why we're seeing this difference in geography. One of those reasons is that when this first started back in March and April, it was a generalised thing where there were cases growing all over the country, and we came to the party quite late, as in there were already well-established outbreaks pretty much everywhere. They would have started, though, if we'd wound March, April back to February, they would have started as initial outbreaks in a small number of handful of places, which would have mushroomed and then spilled over across the rest of the country. So what we're seeing with these currently localised outbreaks are the early stage of what will then saturate across the country. That's the nature of the beast. Also, those places had a bit of a head start, and those places are also the ideal incubators for infection rates to rise more promptly. And also, places like London that were very hard hit in the first place. Scientists agree that because about 1 person in 5 in London has antibodies, as far as we can tell, proving they have previously been infected, that means that there are fewer people who are infectable. It's not a perfect solution, but it means there is more immunity in that population. So the virus finds it that bit harder to gain traction in London, as well as the fact that there are more people in London on average who have the option not to work in the office. They can work from home. So as a result, it's been easier to block the outbreaks in London than it has in places like Manchester.
Let me ask you this lastly. I don't know if virologists believe in crystal balls, but if you have one and you look into it, what do you see over the next 3 months taking us to year end and the start of next year?
Unfortunately, I see more of the same, and I also see more politicians responding to the same sorts of pressures. And we really urgently need people to start having a conversation where we stop calling a death, and we start looking at the number of life years that are being impacted by this, because the sad death of an 80-year-old person is not equatable with the death of an 8-year-old person. But that's the way when we say there are this many deaths, that's effectively what we're doing. We're completely missing the point that if we bankrupt the country, if we make people intellectually, educationally destitute because they haven't had their education either at school or at university, we are robbing those people of their health in the long term, because the best predictor of a person's health in the long term actually is how well educated they are and how much money is in their pocket. And we are depriving people who are young of both of those things, and that is going to have a huge health cost, notwithstanding the other huge health cost to people who are not being treated, because we're paralysing the NHS and focusing it exclusively on COVID. We must have a conversation about those impacts as well, so that we can make a plan for the long term, because at the moment the pill is very much in danger of becoming much worse than the ill it's trying to treat.
Yes, the operations are successfully killed the patient. Doctor, thank you. Always good speaking with you. Chris Smith, broadcaster, goodness, words of wisdom. They're broadcaster with self virologist based at the University of Cambridge, 13 after 7. Listening to that, and Chris, they're talking about the pressures on the NHS. Let's bring Mike Grocott into the conversation. Now, he's a professor of anaesthesia and critical care at the University of Southampton and is himself a critical care doctor. Let's talk a little bit about the pressures. We're entering the winter. How healthy is the NHS at this current time? Good morning.
Good morning, Nick.
I think the NHS is still recovering. It didn't go into the whole COVID pandemic in great shape. I think we knew that already. And there was an enormous strain, enormous reorganisation very rapidly in the spring, which is now largely unwound. But I think the NHS, whilst it's much better prepared, is also feeling somewhat bruised at the moment.
And again, if I can ask you, what do you see over the next 3 months and into the start of next year, Professor?
I hope that we'll avoid the dramatic surge that we had in the spring. But I think we are likely to be stuck with a very sustained, probably less substantial in terms of numbers, but a very sustained surge, and probably this pattern of regional variation. So some parts of the country will have healthcare that's actually pretty overpressed. So I think we're nearly there now in parts of the north of England. Others will be relatively spared, but that will be driven largely by the restrictions that we have socially.
Lastly, you're a professional on the field. When you see the media, and I include myself in it, reporting breathlessly that we're up 25% here and up there, and these figures are... Do you think this needs to be treated with a degree of caution, or is it the alarm that sometimes spark justified?
So I think it's very easy to overreact to the figures on an individual day. The figures will, as you know, bounce up and down a little bit, but there's a very clear... There's a very clear picture at the moment that there's a slow but progressive and sustained increase in the number of patients being admitted each day, the total number of patients in hospital, and now the number of patients who are on intensive care units and receiving mechanical ventilation. And at some point, the system can no longer withstand that. So we have to hope that either that curve flattens, or we will have to contemplate further restrictions.
John, I turn to you. Thanks. My granddad is Professor of Anaesthesia at Critical Care at the University of Southampton, and is a critical care doctor himself. I just know that if you're in London, possibly, as is explained by my first contributors, less likely to strike as much as the northern towns do with the situation where you are now, particularly if you're in Manchester, which is still the COVID capital, COVID centre of the UK. And I say the UK, not just England, but the United Kingdom. I'm also very interested to hear what you made of the Prime Minister yesterday. It's not the ideal location, is it? Online in an empty, I don't know, what was it, Carpet House or something like that, with no audience. Difficult to play to, but he says he's back on track.
I've read a lot of nonsense recently about how my own bout of COVID has somehow robbed me of my mojo, and of course this is self-evident too.
Well, let's see what happens with Witty and Valance getting back and start putting the injections in again. 7:16 LBC News headlines, Simon Conway.
The leaders of Manchester, Liverpool, Leeds and Newcastle are warning local lockdown restrictions aren't working and are confusing. 3 major universities have moved their classes online because of coronavirus outbreaks, and there are concerns over the supply of vital testing materials for conditions including COVID, following a supply chain problem with the pharmaceutical giants. The weather, showers and sunny spells before rain in the west later, a high of 16 degrees.
LBC Travel, I'm Joanne Webb on the trains. London North Western and Avanti West Coast services are running to Milton Keynes Central and Euston. It's all down to a signal failure, which also means that southern services are suspended between Milton Keynes Central and Watford Junction. On the road, still only one lane open on the M25 clockwise just after junction 15 at the M4, and that's because of an investigation and there are queues on the approach. Delays of about 20 minutes on the M11 southbound to junction 7 at Harlow following an accident, but the good news is all the lanes are back open and still very slow on the A40 westbound to Greenford, and that's following an accident.
This is LBC.
There's loads to think about right now. Like, what am I going to do for my birthday if my mates can't come round? Should I get one of them face masks that makes my mouth look like a tiger's? And when Mum and Dad get to cycle to Brighton for the British Heart Foundation? Actually, how are they going to get money if it doesn't happen? And what does that mean for my granddad? He had 2 strokes, and now he's got vascular dementia. So please, give 3 quid to the British Heart Foundation. They really need it right now, so scientists can keep beating heart problems and loads more.
Nick Ferrari now. 0345 6060 973. This is LBC.
Hi, I'm Richard, the Tier 4 Customer Service Assistant on the Underground. I'd like to tell you how we're making it safer for you to travel at the moment. Everyone must wear a face covering at all times on public transport, unless you're exempt. There are also directions around the stations for everyone to follow to help with social distancing. As someone who spends all day on the tube, it's great to see how many of our customers are embracing it. We're ready when you are. To the Mayor of London and TfL, every journey matters.
I've been in the home all day. I've been working from home and had to pop out to go and collect the children from school. And during that time, we'd been burgled, so in broad daylight. I think it really hits home when you come into your children's bedrooms and you see the children's bedrooms have been turned upside down. So the break-in was a real wake-up call in terms of having to do something about the security of the house. So we did a complete review. The first product I bought was the ring floodlight cam, and that was purely because I had an existing floodlight at the front of the house. It was easy to install, and it's something I could do instantly. Because the ring floodlight cam was at one side of the house, the ring doorbell is at the other, and it gives us that total coverage across the front of the property. With the ring system, I get a notification if someone is on the property. So as long as my phone stays quiet, I know there's no one on the property. And having that level of reassurance all the time is worth its weight in gold.
Join Matt and the millions of people protecting their homes with Ring. Learn more at ring.com.
UK employers. The way you hire from the EU is changing from the 1st of January 2021. To hire anyone new from outside the UK, you'll need to register as a licensed sponsor. Getting a license normally takes 8 weeks and fees apply. New employees from outside the UK will also need to meet language, job and salary requirements. Find out everything you need to know about the UK's points-based immigration system at gov.uk/hiring from the EU.
Nick Ferrari at breakfast on LBC. Call 0345 6060 973.
20 after 7, come to your reaction on this regional split there regarding COVID in just a moment. Quickly through the front pages of the newspapers as they perhaps in part set the agenda for this morning. And this suggestion of more curbs to come features on a number of the front pages. The Daily Mail, and we're looking at this in more detail later in the show. The world's top scientists rage against lockdown. This is obviously globally, of course, not just here in the UK. Life should be allowed to return to normal. 4,000 doctors and medical experts signing what's called a